Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
After the birth of a viable neonate, a 20-year-old primiparous client comments to her mother and the nurse about the baby. Which of the following comments would the nurse interpret as a possible sign of potential maternal-infant bonding problems? 1. He's got my funny-looking ears. 2. I think my mother should give him the first feeding. 3. He's a lot bigger than I expected him to be. 4. I want to buy him a blue outfit to wear when we get home. The correct answer is 2. Avoidance, hostility, or low-key passive behavior toward the baby may be a cue to potential bonding problems. The nurse should encourage the client to give the baby the first feeding to begin the bonding process. Expressions of disappointment with the baby's gender may also signal problems with maternal-infant bonding. Comparing the baby's features to her own indicates identification of the neonate as belonging to her, suggesting bonding with neonate. Comparing the actual neonate with the fantasized neonate is a normal maternal reaction. Wanting to buy a blue outfit indicates an interest in and connection with the neonate and is a sign of bonding. A primiparous client has just given birth. The primary healthcare provider has informed the labor nurse that he believes the uterus has inverted. Which of the following would help to confirm this diagnosis? Select all that apply. 1. Hypotension. 2. Gush of blood from the vagina. 3. Intense, severe, tearing type of abdominal pain. 4. Uterus is hard and in a constant state of contraction. 5. Inability to palpate the uterus. 6. Diaphoresis. The correct answers are 1, 2, 5, and 6. Uterine inversion is indicated by a sudden gush of blood from the vagina, leading to decreased blood pressure, and an inability to palpate the uterus, since it may be in or protruding from the vagina, and any signs of blood loss, such as diaphoresis, paleness, or dizziness could be observed at this time. Intense pain and a hard contracting uterus are not associated with uterine inversion. After a lengthy labor process, a primigravid client gives birth to a healthy newborn boy with a moderate amount of skull molding. Which of the following would the nurse include when explaining to the parents about this condition? 1. It is typically seen with breech births. 2. It usually lasts a day or two before resolving. 3. It is unusual when the brow is the presenting part. 4. Surgical intervention may be necessary to alleviate pressure. The correct answer is 2. Molding occurs with vaginal births and is commonly seen in newborns. This is especially true with primigravid clients experiencing a lengthy labor process. Parents need to be reassured that it is not permanent and that it typically lasts a day or two before resolving. Molding rarely is present if the fetus is in a breech or brow presentation. Surgical intervention is not necessary. To determine whether a primigravid client in labor with a fetus in the left occipital anterior position is completely dilated, the nurse performs a vaginal examination. During the examination, the nurse should palpate which of the following cranial sutures? 1. Sagittal. 2. Lambdoidal. 3. Coronal. 4. Frontal. The correct answer is 1. The sagittal suture is the most readily felt during a vaginal examination. When the fetus is in the LOA position, the occiput faces the mother's left. The lambdoid suture is on the side of the skull. The coronal suture is a horizontal suture across the front portion of the fetal skull that forms the anterior fontanelle. It may be felt with a brow presentation. The frontal suture may be felt with a brow or face presentation. Which of the following would be the priority when caring for a primigravid client whose cervix is dilated at 8 centimeters when the fetus is at 1+ station and the client has had no analgesia or anesthesia? 1. Giving frequent sips of water. 2. Applying extra blankets for warmth. 3. Providing frequent perineal cleansing. 4. Offering encouragement and support. The correct answer is 4. The client is in the transition phase of the first stage of labor. During this phase, the client needs encouragement and support because this is a difficult and painful time when contractions are especially strong. Usually, the client finds it difficult to maintain self-control. Everything else seems secondary to her, as she progresses into the second stage of labor. Although ice chips may be given, typically the client does not desire sips of water. Labor is hard work. Generally, the client is perspiring and does not desire additional warmth. Frequent perineal cleansing is not necessary unless there is excessive amniotic fluid leaking. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A 19-year-old primigravida client at 38 weeks gestation is 7 centimeters dilated and the presenting part is at +1 station. The client tells a nurse, "I need to push." Which of the following would the nurse do next? 1. Use the McDonald procedure to widen the pelvic opening. 2. Increase the rate of oxygen and intravenous fluids. 3. Instruct the client to use a pant blow pattern of breathing. 4. Tell the client to push only when absolutely necessary. The correct answer is 3. Pushing during the first stage of labor, when the urge is felt but the cervix is not completely dilated, may produce cervical swelling, making labor more difficult. The client should be encouraged to use a pant blow pattern of breathing to help overcome the urge to push. The McDonald procedure is used for cervical circlage for an incompetent cervix and is inappropriate here. Increasing the rate of oxygen and intravenous fluids will not alleviate the pressure that the client is feeling. The client should not push even if she feels the urge to do so, because this may result in cervical edema at 7 centimeters dilation. Assessment of a 15-year-old primigravida client at term and active labor reveals cervical dilation at 7 centimeters with complete effacement. The nurse should assess the client for which of the following first? 1. Uterine inversion. 2. Cephalopelvic disproportion. 3. Rapid third stage of labor. 4. Decreased ability to push. The correct answer is 2. Adolescent pregnancy carries an increased risk of pregnancy-induced hypertension, iron deficiency anemia, and CPD. CPD is a concern because maturation of the skeletal bones is commonly not complete in adolescence. Adolescent labor does not differ from labor in the older woman if no CPD is present. A prolonged first stage of labor and poor fetal descent may indicate that CPD exists. Uterine inversion, a rapid third stage of labor, or decreased ability to push may occur regardless of the client's age. The primary healthcare provider prescribes an amniocentesis for a primigravida client at 35 weeks gestation in early labor to determine fetal lung maturity. Which of the following is an indicator of fetal lung maturity? 1. Amount of bilirubin present. 2. Presence of red blood cells. 3. Bar body determination. 4. Lecithin sphingomyelin. The correct answer is 4. To determine fetal lung maturity, the sample of amniotic fluid will be tested for the L/S ratio. When fetal lungs are mature, the ratio should be 2:1. Bilirubin indicates hemolysis and, if present in the fluid, suggests Rh disease. Red blood cells should not appear in the amniotic fluid because their presence suggests fetal bleeding. Bar body determination is a chromosome analysis of the sex chromosomes that is sometimes used when a child is born with ambiguous genitalia. A primigravida client admitted to the labor area in early labor tells a nurse that her brother was born with cystic fibrosis, and she wonders if her baby will also have a disease. The nurse can tell the client that cystic fibrosis is 1. X-linked recessive, and the disease will only occur if the baby is a boy. 2. X-linked dominant, and there is no likelihood of the baby having cystic fibrosis. 3. Autosomal recessive, and that unless the baby's father has the gene, the baby will not have the disease. 4. Autosomal dominant, and there is a 50% chance of the baby having the disease. The correct answer is 3. Cystic fibrosis and other inborn errors of metabolism are inherited as autosomal recessive traits. Such diseases do not occur unless there are 2 genes for the disease present. If one of the parents does not have the gene, the child will not have the disease. X-linked recessive genes can result in hemophilia A or color blindness. X-linked recessive genes are present only on the X chromosome and are typically manifested in the male child. X-linked dominant genes, which are located on and transmitted only by the female sex chromosome, can result in hypophosphatemia, an inborn error of metabolism marked by abnormally low serum alkaline phosphatase activity and excretion of phosphorethylamine in the urine. This disorder is manifested as rickets in infants and children. Autosomal dominant gene disorders can result in muscular dystrophy, Marfan syndrome, and osteogenesis imperfecta. Typically, a dominant gene for the disease trait is present along with a corresponding healthy recessive gene. A 24-year-old prima gravida client in active labor requests use of the jet hydrotherapy tub to aid in pain relief. The nurse bases a response on the understanding that this therapy is commonly contraindicated for clients with which of the following: 1. Ruptured membranes. 2. Multifetal gestation. 3. Diabetes mellitus. 4. Hypotonic labor patterns. The correct answer is 1. Some primary healthcare providers do not allow clients with ruptured membranes to use a hot tub or jet hydrotherapy tub during labor for fear of infections. The temperature of the water should be between 98 degrees Fahrenheit and 100 degrees Fahrenheit to prevent hyperthermia. Jet hydrotherapy is not contraindicated for clients with multifetal gestation, diabetes mellitus, or hypotonic labor patterns. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. The nurse is performing effleurage for a prima gravida client in early labor. The nurse should do which of the following? 1. Deep kneading of superficial muscles. 2. Secure grasping of muscular tissues. 3. Light stroking of the skin surface. 4. Prolonged pressure on specific sites. The correct answer is 3. Light stroking of the skin, or effleurage, is commonly used with the Lamaze method of childbirth preparation. Light abdominal massage with just enough pressure to avoid tickling is thought to displace the pain sensation during a contraction. Deep kneading and secure grasping are typically associated with relaxation massages to relieve stress. Prolonged pressure on specific sites is associated with acupressure. Which of the following would the nurse include in the teaching plan for a 16-year-old prima gravida client in early labor concerning active relaxation techniques to help her cope with pain? 1. Relaxing uninvolved body muscles during uterine contractions. 2. Practicing being in a deep meditative, sleep-like state. 3. Focusing on an object in a room during contractions. 4. Breathing rapidly and deeply between contractions. The correct answer is 1. Childbirth educators use various techniques and methods to prepare parents for labor and birth. Active relaxation involves relaxing uninvolved muscle groups while contracting a specific group and using chest breathing techniques to lift the diaphragm off the contracting uterus. A deep meditative, sleep-like state is a form of passive relaxation. Focusing on an object in the room is part of Lamaze technique for distraction. Breathing rapidly and deeply can lead to hyperventilation and is not recommended. The cervix of a 15-year-old prima gravida client admitted to the labor area is 2 centimeters dilated and 50% effaced. Her membranes are intact, and contractions are occurring every 5 to 6 minutes. Which of the following should the nurse recommend at this time? 1. Resting in the right lateral recumbent position. 2. Lying in the left lateral recumbent position. 3. Walking around in the hallway. 4. Sitting in a comfortable chair for a period of time. The correct answer is 3. Most authorities suggest that a woman in an early stage of labor should be allowed to walk if she wishes, as long as no complications are present. Birthing centers and single-room maternity units allow women considerable latitude without much supervision at this stage of labor. Gravity and walking can assist the process of labor in some clients. If the client becomes tired, she can rest in bed in the left lateral recumbent position or sit in a comfortable chair. resting in the left lateral recumbent position improves circulation to the fetus. A primiparous client who has just given birth to a healthy term neonate after 12 hours of labor holds and looks at her neonate and begins to cry. The nurse interprets this behavior as a sign of which of the following? 1. Disappointment in the baby's gender. 2. Grief over the ending of the pregnancy. 3. A normal response to the birth. 4. Indication of postpartum blues. The correct answer is 3. Childbirth is a very emotional experience. An expression of happiness with tears is a normal reaction. Cultural factors, exhaustion, and anxieties over the new role can all affect maternal responses. So the nurse must be sensitive to clients' emotional expressions. There is no evidence to suggest that the mother is disappointed in the baby's gender, grieving over the end of pregnancy, or a candidate for postpartum blues. However, approximately 80% of postpartum clients experience transient postpartum blues several days after childbirth. A 24-year-old prima gravida client who gives birth to a viable term neonate is prescribed to receive oxytocin intravenously after delivery of the placenta. Which of the following signs would indicate to the nurse that the placenta is about to be delivered? 1. The cord lengthens outside the vagina. 2. There is decreased vaginal bleeding. 3. The uterus cannot be palpated. 4. Uterus changes to discoid shape. The correct answer is 1. The most reliable sign that the placenta has detached from the uterine wall is lengthening of the cord outside the vagina. Other signs include a sudden gush of vaginal blood. Usually, when placenta detachment occurs, the uterus becomes more firm and changes in shape from discoid to globular. This process takes about 5 minutes. If the placenta does not separate, manual removal may be necessary to prevent postpartum hemorrhage. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A 21-year-old prima gravida client at 40 weeks gestation is admitted to the hospital in active labor. The client's cervix is 8 centimeters and completely effaced at 0 station. During the transition phase of labor, which of the following is a priority nursing problem? 1. Urinary retention. 2. Hyperventilation. 3. Ineffective coping. 4. Pain. The correct answer is 4. During transition, contractions are increasing in frequency, duration, and intensity. The most appropriate nursing problem is pain related to strength and duration of the contractions. Insufficient information is provided in the scenario to support the other listed nursing diagnoses. Urinary retention would be appropriate if the client had a full bladder and was unable to void. Hyperventilation might apply if client was breathing too rapidly, but there is no evidence this is occurring. Ineffective coping might apply if the client said, "I can't do this," or something similar. A prima gravida client in the second stage of labor feels the urge to push. The client has had no analgesia or anesthesia. Anatomically, which of the following will be the best position for the client to assume? 1. Dorsal recumbent. 2. Lithotomy. 3. Hands and knees. 4. Squatting. The correct answer is 4. Anatomically, the best position for the client to assume is a squatting position because this enhances pelvic diameters and allows gravity to assist in the expulsion stage of labor. This position also provides for natural pressure anesthesia as the fetal presenting part presses on the stretched perineum. If the client is extremely fatigued from a lengthy labor process, she may prefer the dorsal recumbent position. However, this position is not considered the best position anatomically. The lithotomy position may be ineffective and uncomfortable for a client who is ready to push. The hands and knees position may help to alleviate some back pain. However, this position can cause discomfort to the arms and wrists and is tiring over a long period of time. A prima gravida client is admitted as an outpatient for an external cephalic version. The nurse should assess the client for which of the following contraindications for procedure? 1. Multiple gestation. 2. Breech presentation. 3. Maternal Rh negative blood type. 4. History of gestational diabetes. The correct answer is 1. External cephalic version is the turning of the fetus from a breech position to the vertex position to prevent the need for cesarean birth. Gentle pressure is used to rotate the fetus in a forward direction to a cephalic lie. Contraindications to the procedure include multiple gestation because of the potential for fetal injury or uterine injury, severe oligohydramnios, contraindications to a vaginal birth, and unexplained third trimester bleeding. If the mother has Rh negative blood type, the procedure can be performed and Rh immunoglobulin should be administered in case minimal bleeding occurs. A history of gestational diabetes is not a contraindication unless the fetus is large for gestational age and the client has cephalopelvic disproportion. The primary healthcare provider has prescribed prostaglandin gel to be administered vaginally to a newly admitted prima gravida client. Which of the following indicate that the client has had a therapeutic response to the medication? 1. Resting period of 2 minutes between contractions. 2. Normal patellar and elbow reflexes for the past 2 hours. 3. Softening of the cervix and beginning of effacement. 4. Leaking of clear amniotic fluid in small amounts. The correct answer is 3. Prostaglandin gel may be used for cervical ripening before the induction of labor with oxytocin. It is usually administered by catheter or suppository or by vaginal insertion. 2 to 3 doses are usually needed to begin the softening process. Common adverse effects include nausea, vomiting, fever, and diarrhea. Continuous fetal heart rate monitoring and close monitoring of maternal vital signs are necessary to detect subtle changes or adverse effects. Prostaglandin gel usually does not initiate contractions. Therefore, the rest period between contractions will be greater than 2 minutes. There is no need to assess reflexes based on prostaglandin use. Leaking of amniotic fluid is not caused by the use of this gel. The nurse is caring for a prima gravida client in active labor at 42 weeks gestation. The client has had no analgesia or anesthesia and has been pushing for 2 hours. The nurse can be most helpful to this client by 1. Changing her pushing position every 15 minutes. 2. Notifying a healthcare provider of her current status. 3. Continuing with current pushing technique. 4. Assessing the client's current pain and fetal status. The correct answer is 2. The normal length of time for pushing is 2 hours. Anything over that time becomes an abnormal situation, and the healthcare provider needs to be notified. Changing the client's position is an appropriate nursing action within the 2-hour time period based on client need and fetal descent. Continuing current pushing supports techniques that have not been successful within the 2-hour time frame. Assessing client pain and fetal status are standards of care for laboring clients, but will not expedite childbirth for a client who has been pushing this long. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.